So asthma is an acute spasm of the smaller air passages in the lungs. It's associated with excessive mucus or sputum, and it's also characterized by the vasoconstriction of your respiratory passages. So essentially, all your respiratory passages are closing up, and you can't exchange gas the way that you need to be. So we have our patient here. EMT, you want to jump in? So some signs and symptoms that you'll see in an asthma patient. Their heart rate will typically be normal, but they'll have an elevated blood pressure and elevated respirations. You'll also see dyspnea, or shortness of breath. They'll be coughing, wheezing. If it's been particularly prolonged, they also might have cyanosis. They'll, of course, have difficulty performing any normal daily activities, and you'll typically find them in the tripod position. Some causes. People with asthma can be triggered by their allergies, pollen, trees. In his case, his sister has asthma and she's allergic to avocados. Emotional distress is also a big one. Also can be triggered by exercise if they just overdo it. And anaphylactic shock, like I said, with the allergies. And the final thing, too, would be exposure to cold air or smoke. Asthmatics, especially severe asthmatics, tend to try to stay away from smokers because they know that it could trigger. So treatments that we can administer as EMTs, you want to administer O2, or ask them if they have a nebulizer. Albuterol is a typical medication that people will have to vasodilate. Also, you have to be prepared to suction large amounts of mucus because, again, it is characterized by excessive mucus. But when suctioning, you have to make sure that you're not withholding oxygen for more than 15 seconds.
That was a real.
Are you all right?
Yeah, I know. I'm
for more than 15 seconds in an adult, 10 seconds in a child, and 5 in an infant.